and good evening, and welcome to Santa's Collier's Facebook Live, Instagram Live, YouTube Live presentation on Your Health is Important. Ask Dr. Collier anything. This is your opportunity to ask your healthcare questions. We want you to tune in, ask in right now. This is your chance. Text people, tell them to join. On all social media, it's AskDrMJ. And tell everybody about Dr. Collier's, Santa Collier's $50,000 store credit giveaway that you can take advantage of. New people signing up can take advantage of. This is your opportunity to do that. Go to the website, lipodrops.com, and you can see that we're giving away $50,000 in store credit, and that is an incredible deal at this time of year in particular because we want you to invest in yourself. This is an opportunity. Tis the season for giving, and everybody's giving gifts to everyone, but give yourself the gift of good health. And so I'm going to reiterate what I talked about this morning on the Rickey Smiley Morning Show on the Wellness Wednesday segment. We talked about this time of year being the perfect opportunity to give yourself the gift of wellness because a lot of people are getting time off that they normally do not have. They can't take time off or won't take time off to go to the doctor, but they have time off. And they'll have time off before Christmas and they'll have time off after Christmas. So call your doctor's office and get in there. Everybody's saying it's the end of the year and they don't have slots, but you can get in somewhere. You can get in somewhere because what you want to do is get these diagnostic tests at the end of the year. First, you want to ask for a comprehensive physical examination. That doesn't have to be given to you by your regular primary care if they won't get you in time. Comprehensive physical examination, a head-to-toe exam for men and women, making sure you take off your shoes and your socks and get your feet examined as well. So we want a comprehensive physical examination. That's number one. Number two, if you are a man, 45 years and older, comprehensive physical examination that includes a digital rectal exam, the finger, okay, and a prostate PSA blood test. Guess what? All available at no cost. For ladies, a mammogram. If you're 45 or older, if you're 40 years or older, and you have not had a mammogram this year, get an order, get your mammogram. Some hospitals don't even require your doctor to order it. They'll just do it. And most of them don't require appointments. You can just walk in. So if the hospital near you has an imaging center, tell them you want to get a mammogram. It's covered by all insurances. So prostate DRE and prostate PSA blood test for men, mammogram for women. And then if you're a man or a woman, 45 years or older, then you need to get a colonoscopy. If you have not had a colonoscopy, colon cancer is expected to be, the colon cancer rates are going up. It's expected to be the number one cause of cancer death by the year 2030. So you want to get early. Now, if you don't have time or don't want to do the prep for a regular colonoscopy, which requires the actual test isn't but about 30 minutes, but the preparation is the full night before, and that's when you're up because they're cleaning your colon out. And so you drink this stuff and it just really has you go in the bathroom all night. And then hopefully one last time before you go to the doctor's office that morning, because it can be challenging once your colon is giving you the desire to empty and you got to drive and you get stuck in traffic. So they have the new thing, the Cologuard, the collector specimen, put it in the box, mail it in, and that is 98% effective in diagnosing colon cancers. If you have had a colonoscopy previously that was abnormal or you had polyps, you don't qualify for that. If you've never had one and you need to get the test, you qualify and you can order the Cologuard. It'll come to you and then you send it in. So Cologuard, Cologuard. You've seen it advertised on television. So comprehensive physical examination for men and women, prostate exam, PSA for men, mammogram for women, colonoscopy for both. And remember, last thing, number 5, when you're gathering with your family members, for, you wouldn't necessarily want to have this conversation at the dinner table on Christmas, but you could. Once everybody's eating and it's deteriorated to jocularity and anecdotes, you could do that. But if not, I'm going to charge everyone that's on this broadcast tonight everyone. You are the medical scribe now for your family. It is your business, if you will, your job to collect the healthcare information for your family. Because I'll ask new patients, what is your health history? Is your father still with us? If they aren't, what did they pass from? If your mother's still with us, what did they pass from? Do you know what your grandparents passed from? And I will oftentimes get the answer, old age, which doesn't mean anything. Everybody gets, if you got old, that's great. But the question is, you don't just die from old age. There has to be some other cause. Chronic conditions that may run in your family, like high blood pressure, diabetes, high cholesterol. Everyone has heart attacks. Everyone has strokes. Is there a type of cancer that is pervasive in your family genetic pattern? So you want to answer and capture that data and then share it with the other family members. You can put it in a database and then email it to everybody and say, mama's mother passed from cancer and daddy's mother passed from breast cancer, and mama's daddy passed from colon cancer, and then we have all of that information, and they all had diabetes and they all had high blood pressure. And then the people that are sitting around the table, your siblings, particularly if you're listening to this broadcast, you're probably over 40. And if you have siblings, say, look, are you on any prescription medications? What are you taking it and why are you taking it? What's the name of the pills that you take? And most people will be happy to share that information with you. It's not a secret. Although women are much easier to share the information than men. Men don't like to feel impaired in front of their peers and contemporaries. So you might have to pull it out, like pulling teeth out of some of the brothers and the uncles in the family. But get that data, find out what's going on in your family so you can prepare for it. You can ask to be tested and or screened for that disease state and, give yourself the gift of good health. So that's what we're talking about today. And this is the key factor. Each and every one of those things that I mentioned are brought to you at absolutely no cost by every insurance company, no matter whether you're on Medicare, Medicaid, or any private insurance, Medicare, Medicaid, and any private insurance as a division of the Affordable Care Act, affectionately referred to as Obamacare. 13 things were mandated to be provided free. That it includes a comprehensive physical examination. So you have to make sure that you ask for, and it is coded by the doctor as a comprehensive physical examination, not just an office visit, not anything else, not follow-up of your blood pressure, diabetes. If you already have those diagnoses, it has to be coded a comprehensive physical examination, which is exactly what you want. And again, at no cost. The colonoscopy at no cost. A screening colonoscopy. You have to ask for a screening colonoscopy. If you let them flip the script and call it a diagnostic colonoscopy, then it's going to cost you a little more money. But free colon screenings, and that is the exact same test. There's no difference in it. It's just what they call it and whether you pay for it or don't pay for it. So the insurance companies pay for it. You don't have to. The colonoscopy. So the prostate for the mammogram, again, at no cost. And the prostate PSA and digital rectal exam at no cost for men. So there we go. Okay, Heidi, let's do it. Santa Collier is in the house giving away $50,000 of store credit at the LipoDrop store. Go to lipodrops.com and you will qualify to capture those savings as well. Let's do a roll call, Heidi. Who we have on tonight? Lynn F. Hi, checking in from St. Louis. Hi, Lynn. How are you? Okay, Spanish P checking in from Houston, St. Louis, and Houston. We got the West and we got the Midwest. Okay. K-Ward Radio, happy Wednesday, everyone. Thank you for tuning in, K-Ward. We appreciate you. Patrick White, good evening, family. One love to you, Patrick, as well. Thank you for tuning in, my friend. Okay. One in. K-Ward checking in from Montgomery. That's what we want to hear. Checking in from Montgomery. Glenda Everett from Warner Robins. Hi, Glenda. Glad to have Warner Robins in the house once again. Okay, Chili Will. Hey, Chili Will from Stockbridge, Georgia. Glad to have your face in the place. As always, one of my early mail adapters. Philip A. Lazenby, good evening from Augusta, Georgia. Phil, thank you for joining me this evening. We appreciate you. Miss Makiba Boland, thank you for joining as well. We greatly appreciate you being here. Winnie King, hey, Winnie, long time. Sending continued blessings and prayers your way, as are we to you, Winnie. Derek Griffin, hey, from Chicago. Hey, Derek, how you doing, sir? Thank you for tuning in as well. Okay, Levelyn Miller, Baton Rouge, Louisiana. Hi, Lebanon. It's a pleasure to hear from you and Baton Rouge once again. Mel P. Graves, Melanie in Dallas. Hey, Melanie, we appreciate you. Like the song. Cheryl Jackson from Jacksonville, Arkansas. Okay, Cheryl. Lysandra White, Palm Harbor, Florida. Hi, Lysandra. We got Florida. We got St. Louis. Big Sexy Toy from Chattanooga, Tennessee. All right, Big Sexy, Chattanooga in driving range. YouTube user, Illinois near Wisconsin border. Okay, that's big. But we glad to have you, YouTube user. Rhonda Pierre. Rhonda in the house. All right, Rhonda. Thank you. That's great. I love that. Okay, Roosevelt Hopkins from Greenville, South Carolina. We got South Carolina. We got Florida. Okay, Sean Big Time Green from Monroe, LA. My very first male follower. Sean, thank you so very much. We appreciate you being in the house as always. R. Shelton, 173. Robert Shelton from Jackson, Mississippi. Hey, Robert, thank you so much for joining us this evening. We'll call you Bob. YouTube's finest. How's everybody? YouTube's finest. Thank you for tuning in as well. We appreciate that. Carol Bolton from Fort Lauderdale, Florida. All right, Florida's in the house. Okay, New York, New Jersey, Detroit. We want to hear from you. Tabor City, North Carolina. Now we're moving up. Now we're moving up the East Coast. Very good. And of course, California. We want California in the house. We got St. Louis. Let's go further west. And Texas. So we want to hear from Texas as well. So thank you so much. Now, this is your show. We've given you a topic. We want you to give yourself the gift of good health and happy holidays to everybody. We want to thank you for taking the time to tune in and capture this healthcare information. We consider it vitally important, but we want to make sure that, again, you don't just hear it for yourself, that you share it with your friends and family. When you're getting together casually, say, hey, Dr. Collier said this, or I heard this about vitamin D, or just share the information. Don't keep it to yourself. Our objective is to reach out and touch as many people as we can so that they can live a long and healthy life. Okay, Heidi, let's put the questions on. Okay, Janet Allen, how can I get rid of a lot of belly fat? Okay, Jeanette, belly fat, lipo drops, lose the muffin top. That is our catchphrase. Belly fat cannot be targeted by exercise. You can do 1,000 squats and have a six-pack underneath 4 to 6 inches of fat, because exercise does not target weight loss. So but fat loss does. If you're burning fat, you're going to burn fat from places that you have fat. If you have fat around your belly, that's where you're going to burn fat. If you have fat on the back of your arms or across your back or on the outer thighs or the inner thighs, that is what will be targeted. So lose the muffin top with lipo drops, taking 1 teaspoon or 1 dropper full, rather, not a teaspoon, 1 dropper full under the tongue. That is where it works. I've had the problem of people squirting it in their mouth and swallowing it immediately. It does nothing in the stomach but get digested. Under the tongue, however, it is absorbed with the efficiency of having received an injection. So when you do that, you hold it under your tongue for 2 minutes and then you swallow it. It tells your body to not store food as fat, but to metabolize the fat, and also to metabolize fat that you already have. So the lipo drops, there's a direct informational video on the YouTube station that tells you exactly how to take the lipo drops. Then we came up with another product, the Lipo Nice. This is a fat burner that literally works while you sleep. It contains cortisol blocker so you don't get that stress hormone, as well as melatonin so you get a good night's sleep, that deep, restful sleep that allows your body to relax, decreases that stress hormone level, and then it's got 3 fat burners in it that allow you to burn fat while you're sleeping. That magical combination, and you can see on the testimonial page from people that have utilized it, how amazing it really is. And all of our testimonials are real people. This is not made up internet stuff. These are actual users of product that are giving their personal testimony because of the success that they have had. So go to the website, lipodrops.com, and you can learn how to lose that muffin top with the lipo drops. Okay. Donnie Gayfield, I have acid reflux every day. I was told to stop taking omeprazole. Don't know why they told you to stop taking it. Omeprazole and the drugs like it, they're in the class of medication called proton pump inhibitors. And originally they would tell people to take them for 4 to 6 weeks because the albino rat number 105 or whatever it was, developed a gastric tumor from taking very high doses of this medication for an extended period of time. Well, what would happen is they would give people a 10-week supply of it. They get great results. They stopped taking it at the direction of the doctor, and the symptoms came back. Doctor wouldn't give them another refill. What would they do? They change doctors to get another refill, because that's how effective this class of medication is. So there's no downside to staying on the omeprazole, but if you're still having acid reflux every day, you do need to be evaluated for an H. pylori gastric infection. This is literally a bacteria that lives inside the stomach. Now, everybody thought that the acidic environment of the stomach would not allow a common bacteria to grow and thrive. But this specific bacteria, called H. pylori, that's uppercase H as in hello, pylori, P-Y-L-O-R-I, can infect the lining of the stomach and give you gastritis, which is inflammation of the stomach, or even ultimately result in a gastric ulcer. Now, taking this product doesn't stop that. It just relieves you from the symptom. So you want to make sure that if you have an H. pylori gastritis, that you treat that with antibiotics. Antibiotics are very effective. You have to take them for 4 weeks. It used to be 6 months, but now you can take a medication prescription that will include omeprazole and 2 different antibiotics, an amoxicillin or penicillin type drug, and a macrolide type drug called Biaxin. It's like azithromycin or the Z-Pak. You take that. There are other alternatives if you're allergic to either of those, but you take it for 2 to 4 weeks, and that will eradicate the H. pylori, and then your symptoms will go away after your stomach heals. So, and you can be reinfected with this, but most of the time, once it's eradicated, it's eradicated. But more importantly, people say, what can I do naturally, Dr. Collier? I need to know what to do. You can change your gut flora. You are a perfect candidate for our lipobiotic products. Go to the website, lipodrops.com. Get the lipobiotic. You take 1 capsule in the morning, 1 capsule in the evening. This will be life-changing for you. It will change the bacteria load in your stomach from bad bacteria, including things like H. pylori, to good bacteria that won't cause gastritis or a gastric ulcer, and give you relief. And I highly recommend you take this every day. Dr. Collier's Essential Trio. 3 things you should take every day to optimize your health: omega-3 fish oil, vitamin D3 at 5,000 international units per day, and probiotics. That 3 essential combination products will be life-changing and give you great relief from the acid reflux, because all you're doing is chasing the symptom with the omeprazole, but it does give you relief and you don't have to stop taking it. Okay, great question. Lynn F., what are the best supplements for blood pressure and cholesterol? Good. Blood pressure and high cholesterol are both inflammatory conditions. So 2 things you can add to what you're taking to control both, because supplements are in addition to, not instead of. You'll still take your prescription medications, because there's no supplement that's going to get high blood pressure under control. But there are supplements that will make the blood pressure easier to control and give you benefit in preventing heart attacks and strokes, which is the ultimate result of uncontrolled high blood pressure. So 2 things: vitamin D, because vitamin D is the body's natural anti-inflammatory, at a therapeutic dose of 5,000 international units. I have people that still, to this day, come to my office and they're taking 600 milligrams or 1,000 milligrams of vitamin D every day. And that is a total and complete waste of time. You have to take a therapeutic dose. The normal level of your vitamin D is 30 to 90. You don't have to go to the doctor to get that measured, though, because a daily dose of 5,000 international units will give you all the benefit that you need. It will not be excessive. It will not be toxic. You can take that dose no matter where you are in your vitamin D level. That will give you benefit. And then omega-3 fish oil, the body's major benefit from cardiovascular disease, because the omega-3 fish oil literally coats and oils the joints. It decreases inflammation inside your blood supply, your arteries. On a cellular level, it calms down that inflammation, which decreases your chance of having a heart attack or a stroke. So vitamin D and omega-3 fish oil will be 3 things I'd recommend. And we also have another couple of things now. A good night's sleep. will also help with that. And of course, weight loss always help. No matter what your weight is, losing weight will help lower your blood pressure. It does not cure your blood pressure. It does not cure your cholesterol. So I have to remind people that you'll lose weight. That will make both of those things easier to control, but it doesn't fix the problem. The problem cannot be fixed. It can only be controlled, at least not with the technology that we have today. Okay, great question. Spanish P. Is there anything that can reduce facial hair on a woman, especially on the chin? Well, as a woman reaches middle age and starts to lower her female hormones, estrogen level, and particularly she still has testosterone. All women have estrogen and testosterone. All men have estrogen and testosterone. The levels are just high on estrogen in women and low testosterone levels, but they do have it, and it is an essential hormone. And for men, and as we age, those numbers start to equalize and or even flip sometimes. So it is important that as your estrogen level goes down, you become more susceptible to facial hair, particularly on the chin. So one of the things you can do is our female product, the Lipo Hers, very good for reestablishing a normal female hormone level naturally. So that will help increase your female hormones, decrease your testosterone, but also boost your libido through the roof and make you feel much better. But the cosmetic thing you can do, there's no downside to just simply shaving the hair off the chin, using a shaving gel. Prepare the skin by using an antibacterial soap to wash and cleanse the skin. Rinse the soap off, apply a shaving gel. Always shave down. Do not stick that razor under your chin and do like that, because then you will get bumps, and you don't want to get razor bumps. There is a myth that if you cut the hair, you cut one hair, two comes back. That is untrue and will not happen. If you have extra hair, it's just more hair growing because of your hormonal status. You correct the hormonal status with the Lipo Hers product, then that will be minimized. But if you need to remove the hair, you can use a debilitator. There are creams that will also do it. And then there's more permanent solutions such as laser hair removal. But if it's just a few chinny hairs that a lot of people get, particularly women, and oftentimes affiliated with a facial neoplasm, like a mole, you have a mole that's got 4 or 5 hairs in it. You can just use a debilitator, or you can shave it. Use a high quality razor with 3 to 5 blades, not just a single blade that you buy at the checkout counter. Get 5 blades for $1. This is not the time to be cheap. Get a decent grade of blade to shave yourself, but you can get shaving gels at the store where everything's $1.25. And let me tell you, high quality products that I use on my face every day. But again, that preparation method, I prep with a bacterial soap, Dial or Lever 2000, rinse off the dirty soap suds, put on the shave gel, let it sit for a second, and I try to warm it up in my palm or either warm it up in a gel warmer, and then stroke down, rinse, stroke down, rinse, stroke down, rinse. Don't keep stroking for 10 times and then finally rinse, because the shave gel on the blades will collect and you won't get a close shave. So, and that minimizes the damage and irritation to your face. Shave down, rinse, shave down, rinse. And you remember, Black people, men and women, shave down. And that is in all areas. That is your face, that is your underarms. You always go down. Do not turn that razor upside down and go like this. You're going to guarantee yourself underarm razor bumps. And in your pubic area, shave down towards your feet. Shave down towards your feet. Do not turn that razor and come back up towards your face, or you're going to get bumps down there as well. Okay, next question. Jack Noble, can't hold my pee. I have to pee all night. How can I fix this? You got 2 problems, Jack. Probably benign prostatic hypertrophy, which means that you're not emptying your bladder. When you're not emptying your bladder, or you could have a condition such as diabetes, which makes you urinate all night, particularly once you stop moving around. So you want to make sure that you rule out those 2 things. The diabetes portion in particular, because that can be done with a finger stick, and you can find that out in 30 seconds when you walk in the doctor's office. However, the most common thing for a middle-aged man is benign prostatic hypertrophy, or BPH. A normal prostate gland should be about the size of a chestnut. As we age, it gets bigger. By the time you're 40, it's about the size of a plum, and it can grow to the size of an apple. The problem is there's no extra space in the pelvic There's no extra space in the pelvic area. So as it starts to grow, it starts to push things away and around, or it grows in. Your urethra, the tube that you urinate out of, goes right through the middle of the prostate. And if that hole is compromised, then you're not going to get good urine flow. What you have to do is, one, limit your fluid intake after a certain period of time. And I would say at least 3 hours before you go to bed. And the last thing you do before you go, you take your feet off the floor and go to bed. You go to empty that bladder. Take the time to completely empty it. Because if your bladder is full, let's say this is your bladder, this is your bladder, this is urine in your bladder. Urine in your bladder, this is your bladder. Okay, you urinate out, it comes down, you lose the urge to urinate. Then the bladder muscle, which is just a muscle, shrinks back down on the new level of fluid, and you get the urge. And you say, wow, I just urinated. I can't even zip my pants up and wash my hands good before I feel like I have to go again. So you urinate out again, then the bladder all shrinks down. That may be a minute or two, sometimes longer, between those things happening, particularly if you've been retaining fluid for a long time in the bladder. The bladder can stretch and become less pliable. So if you're in a public event and you're urinating and 3 or 4 young people come and go next to you and you still sitting there, you just have to take the time to empty the bladder. Now, more serious conditions where you really are retaining urine may require a thing called self-capping, where you literally stick a straw or catheter up into the urethra and through the bladder to empty it so that you're not retaining urine. So you need to have an evaluation by your primary care doctor and ultimately probably a urologist as well to address those things. But again, it's an inflammatory condition. Prostate health is maintained with products for our men. We have the Lipo T, which is a very good product for prostate health as well. So you can do that and get some great benefit. Again, natural anti-inflammatories, omega-3 fish oil, vitamin D, frequent ejaculation for a man. Frequent ejaculation, because the prostate is nothing but a sponge that fills up with fluid, that fluid being the ejaculate. When you ejaculate, it has 2 things. It has spermatic fluid and it has sperm cells. The fluid just provides an environment for the sperm cells to swim in. It's like a swimming pool for the sperm. Your testicles make the sperm. Your prostate makes the prostatic fluid. When you ejaculate, that combination comes out, and that is what happens. So the thing is, when you do that, the prostate has a muscular capsule around it. It's like taking a sponge and holding it over the sink and going and wringing it out, letting all the fluid out of it. Then the sponge shrinks down. You can wipe up the counter again. Well, when you frequent ejaculation, and when I say that, I mean a minimum of 2 times per week, and that's spread out. That's not 2 times on Friday. Okay, that would be maybe midweek and then once or twice on the weekend. But 2 times a day is not too much. You cannot ejaculate enough to maintain excellent prostate health. The more you do it, the healthier your prostate will be. So this is Dr. Collier's prescription to my male listeners and watchers. You need to ejaculate as often as possible to maintain good prostate health. You need your medicine. So you need a cooperating partner who, you're hearing it here, ladies. Dr. Collier is saying this is a real phenomenon that men do need to ejaculate regularly to keep their prostates minimal size and optimize their urinary tract function. So let's get with the program. Give daddy his medicine. Okay, thank you very much. Next question. 2 reads, should we take vitamins daily? And if so, which ones? What proactive things should be? In a group for over 40, be doing preventive treatment. Okay, not just over 40, but under 40 as well. Dr. Collier's Essential Trio, omega-3 fish oil. It need to taking at least 3,000 to 4,000 milligrams per day. Most commonly, capsules available over the counter are 1,000 milligrams. Our capsules are 1,480, so you only need to take 2. You take 1 in the morning, 1 in the evening. You're meeting your criteria. The probiotics, which changes everything about your body in a positive way. It helps with allergy symptoms. It boosts your immune function. It helps with gut flora and changes your things like eczema, allergies, skin allergies, etc. It fixes all of those things. And then food allergies. It corrects what the phenomenon known as leaky gut syndrome and allows you to tolerate and benefit from various types of foods and helps keep your weight down. And then then vitamin D rather. Vitamin D3 at 5,000 international units per day in reference to a multiple vitamin. a complete multiple vitamin with iron and minerals. Okay, there's no such entity as a generic vitamin. There's no better way to make them. You should be able to get a bottle of 100 for $10 to $15. If you're in the store and you have a branded product, one a day for men, one a day for women, and next to it, it says the Kroger brand, the Publix brand, the Target brand, compare to, and it is comparable. So get the less expensive version. The problem is everybody's got vitamins at their home. Most of the time, the bottle is unopened and untapped, or people take it for a week and then they stop taking it, although they got 100 pills in the bottle. So the most important thing about a vitamin is actually taking it and also making sure it is a complete multiple vitamin. The key phrase is complete. A multiple just means more than one or two. It could be one, it could be two, it could be three. You want a complete that's got every vitamin in there at 100% of the daily requirements and and minerals and iron. So you want to make sure that you have met that criteria. And lots of products do that. Don't get 15 different bottles of vitamins, one with vitamin E, one with vitamin C, and one with vitamin B12. No, you can get it all in one pill, and the pill is not too large to swallow. And then if you have difficulty with vitamins, as some people do, the Flintstones chewable are good, and now they got vitamins in gummies that are preparative as well. So those are the three things: Dr. Collier's Essential Trio and a complete multiple vitamin. And then doing seasonal things like right now, products like my Autoimmune will get you through the respiratory tract season without you catching or making you less susceptible and getting milder cases of the flu, the COVID, the respiratory syncytial virus, etc. So great question, too, Reese. And he's back. What's good for stress? Lady D. That's a great question, because if you are an African American or a person of color in the United States of America, you are under stress all day, every day. If you are working for somebody, you are under stress all day, every day. If you work for yourself and own your own business, guess what? You are under stress all day, every day. So it's difficult to avoid stress. So what's important is how we respond to it, because we cannot remove life stressors. Everybody say, well, boy, I'm going to hit the lottery. People that have hit the lottery are under more stress than anyone else. So you cannot avoid stress. You can't avoid stress in your interpersonal life. Stress with your significant other, stress with your children, stress with your parents. It's stressful. Life is just stressful. So how do you keep things done? You take those things. Stress causes inflammation. You take natural anti-inflammatories. Again, like our vitamin D, our omega-3 fish oil, the probiotics, Dr. Collier's Essential Trio are very good. Other things that you can do naturally: yoga, Tai Chi, meditation, prayer. Doesn't have to be complicated. You don't have to join the spa. You don't have to go to LA Fitness or Orange Theory or anything like that. You can find your space. It can be in the corner. It can be in the closet. It can just be in the bathroom, where you close your eyes for a minute, meditate, relax. And it doesn't take but about two minutes of meditation to make a major difference in your life. If you can do 5 minutes to 15 minutes, that's even better. But 2 minutes has been shown to be very effective in reducing stress, calming yourself down, controlling your breathing, in through your nose, out through your mouth, relaxing mentally, go down your body, relax your neck and your shoulders, relax your torso and your abdomen, relax your thighs, all the way down to your feet. You can do that exercise whenever you feel the need to decompress. In through your nose, out through your mouth, and just feel those muscles relax. Okay, great question, Lady D. Mel P. Graves, I have arthritis in my lower back. Is there anything I can do to get rid of it? No. Ease the pain? Yes. It only hurts when I'm walking for a long period of time. Mel P., welcome to my world. Arthritis in the lower back is a fact of life, because we are not designed to walk upright, yet we do. That puts excessive stress on our lower back, affectionately referred to as the lumbar spine. And so ergonomics of your sitting place. Sitting is now the new smoking. A lot of people aren't smoking, so smoke isn't the health challenge that it was. But everybody is sitting because they're Netflix and chilling, and they are sitting, they're streaming, and they're doing things. They're spending more time in the chair than they traditionally have. And so the first thing you do for your lower back is get up and move. If you are in a job that requires you to sit at a desk, Do not sit for more than 2 hours at one time. Get up, take a few laps around the desk or around the room or whatever. Just move and relax your body. Move your spine in one plane. Do not roll around. If you're standing up, you go one side, straighten up, one side, straighten up, realign your spine. Go to the other side, straighten up, other side, straighten up, realign your spine, lean back, lean back. This is the most effective. Lean back and then leaning forward. You can sit in the chair or you can stand up and reach down as if you're trying to touch your toes. That will give you great benefit. But do this slowly and with design. Do not try to bounce down. That is how you rupture a disc in your back. So you go, you bend over, you try to touch your toes, you go as far as you comfortably can, and you ease up. And then you go as far as you comfortably can. You try to do about 10 reps. And as you do that, you will develop more flexibility. And before you know it, you'll be laying your palms on the floor and you will have much better back health. So exercises, again, like Tai Chi and yoga will also help. But the arthritis cannot be cured. It can be controlled. Again, one of the best things I like for arthritis pain is omega-3 fish oil because it kind of oils the joints and it calms down the inflammation in the joints. So omega-3 fish oil is good. And then natural anti-inflammatories such as turmeric and curcumin are very good as well. There are topicals that you can apply now. There's an anti-inflammatory prescription medication. Well, it used to be prescription. Now it's over the counter called Voltaren or diclofenac. It is a cream or a gel that you can apply to the back area where you're hurting, or even they have patches that will do that as well now. Instead, they'll hold the medicine in place. And then oral medications, Tylenol, if you can, and you're not on blood thinners and don't have any problems with your kidneys, you can take Motrin, you can take Advil, you can take Aleve. Everybody has one of those that they swear by and thinks it gives them great relief. So just try to see which ones you get the better relief from. Once again, you can get generic versions of these medications at the store where everything's $1.25. So try, get a box, see what works best for you before you buy a big bottle and see which gives you the most relief. Okay, but the main thing, this is an ergonomic problem. So your seating posture, make sure that your chair is giving you the appropriate support, making sure that your workspace is one where you're not leaned over, cramped over, or anything like that. And then don't sit for more than 2 hours at one point at work or at home. Okay, great question. CC Mill, what can I take for pain if I can't take ibuprofen? Okay, if you can't take ibuprofen and if you're allergic to it, then you can try. Ibuprofen is the same as Advil. You can try Aleve, which is naproxen, or Tylenol. Now, Tylenol is a great alternative. Tylenol is great for pain. Tylenol is not. Tylenol is not. Tylenol is not an anti-inflammatory, but it does give you great pain relief. The regular strength Tylenol tablet is 325 milligrams. You can take 2 of them. If you need more, you can go to the extra strength or arthritis strength Tylenol, which are 500 milligram tablets. So you take 2 of them, that's 1,000 milligrams. You can take 2 of them up to every 6 hours if you need to for pain relief. That is perfectly safe to do so. Some people, when they're hurting, they alternate an anti-inflammatory like ibuprofen and naproxen sodium with a Tylenol, taking one every 2 to 4 hours. But if it's not that bad, then, and you can't take, if it's a matter of not taking ibuprofen because of another reason, like you on blood thinners, etc., then Tylenol is the only alternative. If it's just that you say are allergic to the ibuprofen, and Advil is ibuprofen, so you can't take Advil, but you can take naproxen sodium, which is Aleve, Aleve. See if that can be tolerated as well. If not, Tylenol, natural anti-inflammatories like curcumin, turmeric, again, the omega-3 fish oil will help. The vitamin D at 5,000 international units per day. Range of motion exercises for whatever is hurting. See if you can stretch it out. Okay, great question, CC. Meet Caldwell. I have Graves' disease. Is it safe for me to take sea moss and sour salt bitters? Also, what would cause elevation in AST levels? Okay, the Graves' disease proper. AST is that's aspartamase. That is a liver enzyme, and it's one of the liver enzymes. There are 3. That one going up by itself and going up, if it's not at least 3 times normal, then it is not of clinical concern. It is just something that you should watch. When there's something substantively or significantly going on with the liver, it's never just an isolated AST level. There's AST and there's SGOT levels. So you can, those 3 things, and alkaline phosphatase, those are the 3 liver enzymes. They can go up, and they all would go up together if there was something substantive or significant going on with the liver. Remember, the liver is your body's detoxifier. It can be, if your AST levels are elevated on a single blood test, I would repeat that blood test in 4 to 6 weeks, particularly after taking something like milk thistle, which is very good for liver health. Sea moss is good as well. Not sure about sour sop bitters and liver issues, but Graves' disease is a thyroid issue. And so you want to make sure that you're getting your thyroid hormone levels corrected. And that is the main thing. And that also, will prevent you from getting the bulging eyes and other issues that you can get with chronic Graves. But you and your endocrinologist who specializes in thyroid disease, or a well-versed primary care doctor that likes working with and knows how to do it, then will give you great benefit. You have to control the Graves' disease continuously. It is a lifetime thing. It rarely just spontaneously resolves, although it can. I've had patients that have Graves' disease that was probably due to maybe a viral infection of the thyroid gland proper or something like that. And then it just got better. God healed them, who knows? But, when that happens, when the miracle happens, but for the vast majority of people, Graves is a chronic disease state that has to be maintained. And that means continuously keeping that and monitoring as well, because what keeps the thyroid levels normal today may not do it tomorrow. You may need more or less to keep your thyroid gland straight. Thyroid is your master hormone, is your thermostat. It controls your level of consciousness, your brain awake and awareness, and your body fat and your body weight. When you have low thyroid, you gain weight. When you have high thyroid, you get super thin. You also can get a racing heart rate, tachycardia, when thyroid is too high. So there's a condition known as thyroid storm, when your thyroid is dangerously high, that is life-threatening. So you have to be very, very careful and conscientious about this. But I think the sea moss is perfectly okay. We have a sea moss product, Dr. Sea Moss, that I'd highly recommend, because our products are purified and of highest quality. We have quality control measures in place. Sea moss is a good product that a lot of people have started adopting. But more importantly, you have people that are manufacturing it, but they're not using the highest quality products. So you're getting products that may be contaminated or not the best for you. So go to the website, lipodrops.com, look at our Dr. Sea Moss, and that will be a product that I recommend for you. Okay. He's back. Elisa Perry Ferdinand, I want to lose belly fat forever and bring down my A1C so I can get off some of my meds. Alicia, getting down your A1C that means you have diabetes. You want to get your A1C down, ideally under 7, hopefully under 6.5. The number for diabetes is greater than 6.5. So 6.6 and higher is a diagnosis of diabetes. 5.8 to 6.5 is pre-diabetes, and everything below 5.8 is perfectly normal. So losing the belly fat would be good. Again, our Lipo Drops product works wonderfully, as well as our Lipo Nights, but you would be a great candidate for the new GLP-1 inhibitor class drugs. That would be Ozempic, Wegovy, Mounjaro, and there's one more. That's a generic version. So the Wegovy, Mounjaro, and the Ozempic. Either one of those will work wonderfully for you. It works virtually 100% of the time. It works wonderfully in everybody. It's obviously safe, because if it wasn't, everybody that's on it will be having some problems. So those are great products that you can get, but you have to have a prescription to get them. Although there are online places that will give you a virtual visit with a doctor and diagnose it and then place it for you. But I like people that are on that program to have real doctors, people they can consult with, because it can be problematic. You want to make sure that some of the side effects that can happen, they don't necessarily have to happen, but a lot of people get it. Slows the gut, slows down gastric emptying, which makes you feel full. And some people it can cause nausea, and some people it can cause extreme nausea and vomiting, and it can cause constipation and or diarrhea. Now, if you take it appropriately, you supplement with a probiotic product, you can minimize or control and or prevent all of that sequelae. But it will make you lose weight because you just literally can't eat, and you'll lose weight from where you have weight. If you got belly fat, you'll lose the belly fat. So one of the things that we highly recommend. But if you want something that's less invasive, or you don't require anything as dramatic as Ozempic or Mounjaro, then our lipo drops, lose the muffin top of the lipo drops, is the ideal product for you. You add the lipo nights and you will get great benefit over a shorter period of time. Great question. James Smith, the name of the tea for me to drink every day with ED. It's lipo tea, uppercase T. It's not tea as in a drink, TEA. It's capsules that you take. And our product comes in a bottle with 90 capsules. You can take 2 or 3 of them every day. If your testosterone is low, if your libido is low, or you have a sense of urgency about your male function, you can take 3. I take 2 every day, but I do take 2 every day. I think it's the greatest thing ever. It really enhances your male function. It enhances your libido. It enhances the intensity and quality of your orgasm. It just gives you a great sense of well-being, and it's perfectly natural. So this is a great product that you take every day. So unlike a Viagra, a Levitra, or a Cialis, which you take right before you have sex, which will give you an erection, but doesn't enhance the quality, doesn't give you a greater libido, doesn't increase your sensitivity, doesn't make it feel better. It just fixes the plumbing problem that allows you to function. And that has benefits. Some people take both. But if you want to be, quote, more natural, as they say, and just be ready when it's time to go, then a product like our Lipo Tea. So go to the website, lipodrops.com. Look for the Lipo Tea. T stands for testosterone because it is a natural testosterone booster, amongst other things. It does several things, but one of them is it naturally boosts testosterone. Saw a patient today in my practice whose testosterone was under 200. He came in today, it was 596, and he's only been on the product for a short period of time. That is an amazing improvement, and he feels wonderful, to say the least, about that product and the benefits that he's gotten from it. So Lipo Tea, James, go to the website, check it out. Arnisha Phipps. Can oil of oregano heal Crohn's disease or ulcerative colitis? This is not a benefit I've heard of. Crohn's and ulcerative colitis are both inflammatory conditions. The two things that I know that will help, omega-3 fish oil and probiotics. Those are two key things. But these were debilitating diseases just a few years ago and have been in the lifetime of my medical practice. There are such great biologic products now. You see commercials on television all day, every day, particularly if you're looking at it at the sports channels. There are medications, again, these are biologics. They work by altering the body's immune response because these are, quote, autoimmune disease states, and they give you great benefit. As a matter of fact, the first drug that was developed was initially just for arthritis patients. And it was promoted heavily by Phil Mickelson, the golfer. Well, people with arthritis who also happen to have Crohn's disease or UC, ulcerative colitis, had great resolution of that symptom as well. And so they looked at it and said, wow, this also helps with that. So arthritis, which is an autoimmune disease, and Crohn's disease or ulcerative colitis, which are all autoimmune diseases as well, both addressed wonderfully by some of these new biologic products. The thing is getting coverage for them because they are mega expensive. But your insurance companies will cover them with that diagnosis, but more natural. What can I do naturally, Dr. Collier? Naturally, probiotics are God's gift to this disease state. I would make Greek-style yogurt, which is basically a good source of probiotics, a everyday thing in your life. Any brand, long as it's Greek style, that's the highest amount of probiotics, or just take probiotics, which are nothing but good bacteria that heal the lining of the colon. It can affect the small intestines as well, but it's more common in the colon. It can be just portions of the colon or throughout the entire colon. And your colon runs from the right side of your abdomen here across at the level of your belly button, and then let me come over here, and then down. So it's like an upside down U there. And so you can have pain, discomfort, cramping, spasms, all of those things. You can have constipation. You can have diarrhea. You can have alternating constipation, diarrhea. And the most biggest problem is the diarrhea, because you never know when it's going to happen. It's explosive sometimes and uncontrollable. So people have to limit the places they go and the things that they do because they have to be concerned. That's why all the commercials that talk about these wonderful breakthrough medications have people out skiing or in the woods picnicking or places where bathrooms aren't readily available, because they have total control of those symptomatology. And it's a great benefit that lasts. And this has been a major breakthrough in the treatment of those disease states. So look up biological or new therapies for the treatment of ulcerative colitis or Crohn's disease, and also the natural things that we talk about: omega-3 fish oil, probiotics, and Greek style yogurt. Great question. Edamame. Okay, edamame. There you go. What's the best way to cope with Epstein-Barr virus flares? I'm in my 60s. Hi. Epstein-Barr, which is one of the herpes viruses, actually, and when it flares up, it can cause chronic fatigue syndrome or a symptomatology complex that's being referred to as chronic fatigue. Now, there's a blood test that determines whether this is actually Epstein-Barr virus, so it can be diagnosed that way as well. But the symptomatology has to be put together to come up with the chronic fatigue diagnosis. That is a diagnosis based on symptoms, recurrence, etc., etc. So, being one of the herpes viruses, a lot of people will use traditional herpes medications such as valcyclovir, but in higher doses than they would for a genital or an oral herpes infection. The standard dose is 1 gram, 500 to 1,000, which is 1 gram milligrams for herpes infection. But for Epstein-Barr, I've seen people taking as many as 4,000 milligrams per day to get great relief from that. Then steroids as well. Medrol dose pack, which is 7, 6, 5, 3, 5, 4, 3, 2, 1 pills on a card that you take. It's a high dose of steroids that you taper down over time, but that hits it hard. Or even steroid injections with Decadron or prednisolone. Those are great options as well. But maintaining good health, decreasing your stress level, taking things like Dr. Collier's Essential Trio will boost your body's immune system and have you less susceptible to flare-ups. So getting that vitamin D in your regimen at 5,000 international units per day, you get that vitamin D level up between 60 and 90. And again, the normal range is 30 to 90, but you want it to be on the high side of normal. 60 to 90 has so many great benefits in reference to inflammatory disease states that you will get great benefit from it. I guarantee it. So add those things, and remember that this can be, sometimes life happens, it will, and you'll just be stressed, miss sleep, things that you cannot avoid that may exacerbate a flare-up. But your mantra is cool, calm, and collected. You will be a perfect person for the 2 to 5 minutes of meditation that I spoke about earlier, where you're closing your eyes, you're humming, come up with a mantra that's your personal thing that gives you find comfort in, or prayer. Prayer gives great relief to people. You can pray anywhere, anytime, under any circumstance, and that will give you great relief as well. Great question. Big sexy toy. All right. I had weight loss surgery in 2013. I was 530 pounds, and I can't get out of 200s. Could my hypothyroidism be a factor also? 100% the hypothyroidism, because low thyroid makes you gain weight and or retain weight. Now, thyroid hormones have a level of normal. If this is low and this is high, you want to be, at worst case scenario, in the middle. Best case scenario, you want to be on the high side, as close to high as you can be. The problem is that when you're getting thyroid replacement, most doctors, this is low, will get you on the low side, and you'll be here outside the low side. This is when your diagnosis is made. And then as soon as they get you here, just barely within the normal range, they stop the dose, or they keep it, they maintain you there. And that's a therapeutic dose, but that's not the optimal dose. In your situation, your thyroid function needs to be optimized, ideally on the high side of normal. So if this is low and this is high, you want to be on the high side of normal right there. That means probably adjusting the dose of your thyroid medication. Then it's very important which one you're taking. The most prescribed thyroid replacement in the United States of America is Synthroid or levothyroxine, left-sided version. Levo means left side because most of these things come in a left-sided version and a right-sided version. Dextro and Levo. Levo is the effective one that works. The right side doesn't, it's not effective, or it's less effective. So they isolate the left-hand version of this product and put it in a capsule, and they give you or a tablet, and that's what you take. Now, but that's not the best thyroid replacement that's out there. There are thyroids that are combinations of T3 and T4. T4 is the inactive thyroid hormone that has to be converted to T3. There are products that are only T4. And so you take that, and then hopefully your body will convert it to active thyroid, which is T3. Some people do that very well. Some people don't do it well at all. The problem is, if you don't do it well at all, you're not going to benefit, or you have to take much higher doses. So cut out the middleman. Just take the D3 or and the thyroid that's T3 rather. The T3, and that will give you great benefit. Products I recommend, there's NP thyroid, there's New Thyroid, there's Armor thyroid. Ask about and Google better ways to treat thyroid disease, and we can get you out of the 200s. No ifs, ands, or buts about that. All right, and then you would also benefit from things that stimulate your metabolism, like our lipo drops and our lipo nights. I have a lot of people who've had weight loss surgery, everything from gastric sleeve to gastric bypass, that are now using those medications as supplements to keep their weight down or to cause additional weight loss, and they are very happy with the results. The lipo drops going under your tongue because they totally bypass the stomach. Under your tongue is like getting an injection. For 2 minutes, then swallow before each meal, and then the lipo nights, 2 capsules at night. And while you're sleeping, you melt away. Okay, now I want to reiterate. That's the last question we're going to take, Holly. I want to reiterate right now that $50,000. Santa Collier is giving away $50,000 in credit on the Lipo Drops site. You go to the website, you get $50,000, and once it's gone, it's gone. It's counting down right now in real time as we speak, as people are taking advantage of this opportunity. You can save much at Christmas time on the Lipo Drops product because we're giving away $50,000 in store credit to get all of your supplements that you want. Get yourself healthy. Now, let's start your health journey now. Don't wait till your New Year's resolution. Gift yourself this Christmas with the gift of good health. Go to the Lipo Drops website right now. Sign up. Join. We want to be able to follow you. We want you to be able to get a lot of good insight that we send out. And follow on the YouTube channel. Go to lipodrops.com /Santa Collier to take advantage of that. You also, don't just go to the YouTube channel, but subscribe to the YouTube channel, and you will get lots of great information on via videos. We take and archive everything. So there are hundreds, if not thousands, of videos about various healthcare topics that you can go and get the questions that you need answered about that. So once again, I want to thank everybody for taking the time out tonight during this holiday season to join us on the Ask Dr. MJ. Why? Because your health is important. Live broadcast where we answer your healthcare questions. So we hope that tonight has been informative. We hope that you have enjoyed the questions. I know that I did. It was a great wide variety of questions, and everybody. You never get to all of them, but we answered as many as we could. But just remember now, you have all been challenged. Your assignment is you are the medical scribe for your family. So when you gather with friends and family over the holiday, particularly family, when you gather with friends, share healthcare information that you've heard from me. Tell them about the Ask Dr. MJ broadcast and have them tune in. Tell them to go to the website. Tell them to go to the YouTube channel, and then they'll see the type of information that's available. But when you're with your family, capture that familial healthcare information, because we want you to know what's in your family, what you need to be screened for, what are you all susceptible to. If you have you're going to get diabetes, we can do some things that can slow the progress, make it milder, or prevent it, hopefully. a high blood pressure, keep your blood pressure controlled, kidney disease, high cholesterol, cancers. If everybody in your family has kidney cancer, colon cancer, pancreatic cancer, you need to be screened for those disease states. And remember, before the end of the year, your comprehensive physical examination, prostate DRE and prostate PSA for men, mammogram for women, colonoscopy for age 45 for men and women, and capture that healthcare data. Merry Christmas, everybody. Santa Collier. We'll see you next time.